Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello and welcome back to the Sit and Stay podcast, brought to you by RipsyTech. I'm RipsyTech Product Manager Parker Anderson. As always, I'm joined by RipsyTech Founder and CEO Tom Tarshis. Hey, Tom.
Hi, Parker. Good to see you.
Good to see you as well. I realized I forgot to do an adjective to introduce you. I haven't done that in a minute now, but
Bet.
Bet? What was that?
Oh, do you know that phrase, Parker?
From like what the youths say? Like bet, like sounds good. Bet, yeah, like that.
Like yes. Well, since you threw out in a minute, you know.
Okay. I'm 31 years old. I feel like in a minute has been around for a while. Bet, that one came out when I was in my 20s, and I that one I don't know. Well, we got to work on our Riz if we're going to be hosting this podcast. For any providers listening that work with children, I'm sure they're having a field day listening to us talk about the new slang. But let's talk about the podcast.
Good redirect.
So, yeah, thank you. So for this week's episode of the podcast, we wanted to talk specifically about, revenue. And this applies to both solo practices and group practices. So some of our questions are going to be more group practice focused and some are going to be more solo practice focused. But in terms of, revenue with a mental health practice, the revenue is being generated by the clinical services that are being rendered. So there's kind of different ways and different categories to allocate the revenue into. So that was what you wanted to talk about on the podcast today. So let's first just talk about, whether you're running a solo practice or you're managing a larger team, why is it important to be intentional about how you allocate the revenue that's coming in?
Yeah, Parker, great. And I think as we've been getting more and more customers at Ripsy, and one of the things we offer is this business advice, it's good for us to be reflecting on what are the questions that we keep answering over and over for our new clients. Right. And I think that's what's spurring on this, hey, charge master and billing, hey, revenue, and hey, budget. And this is an opportunity, I think, for us to look at what is important, what are educational gap areas that we don't get training in, and see if we can put together some resources both via podcast and through some other training videos to help people out. And I think it's not the social justice platform I can get on and talk about for a long time about kids' mental health or a broken mental health system, but it is something else I'm passionate about and trying to help people get your budget together and understand insurance billing and understand revenue. And the reality is, over and over in our field, and we are seeing this with our new customers, I would say, I don't even know if any of our current customers have actually put together a budget before starting their practice. And this includes people who've been in practice for decades. Hopefully I'm wrong about that, but whenever you're working as a sole proprietor, regardless of your field, if you can pay your bills and take some money out as a paycheck each month, maybe it becomes a lower priority. But to really do things the right way and understand these models and be able to, make more money or predict the future, or, hey, something serious has come up and I can't work for a month. Am I going to be okay? I am passionate about trying to empower people with that knowledge. And so that's why I wanted to keep going on this path where let's talk about some basic revenue models and why this field is different from other businesses. And then it's going to be really fun stuff to move on to that Make Your Budget podcast episode or two and that tutorial. But the basic answer to your question is being thoughtful and intentional and aware. And we're just going to try to talk about revenue streams today. It's going to help all aspects of your business, your pay, your future, and whether you're in solo practice or in a big group or wanting to build a big group. And that is why we need to talk about this.
Okay. All right. Good start. So I think maybe let's just dive straight into what the actual categories themselves are. So when we were talking about planning this episode, you mentioned the three main categories being clinician pay, operational costs, and business savings. So let's walk through those and how you think. Let's start with the group practice. How a typical group practice should think about splitting like percentages between paying their clinicians, paying for their operational costs, and putting a little bit into business savings.
Very good. Yeah. And I think a lot of clinicians have some idea about one of these categories. But before we jump into these categories, we want to acknowledge that being a clinical service provider is a unique business type situation. In general, most businesses, so all businesses have a product that they sell, essentially. Traditional businesses, it's, food, construction services. You can think about all these other items where there's some sort of product or item that's coming out of it. And that is actually what generates the revenue. And then you have to pay your employees, operational costs, et cetera. But in a model where you're a service provider, and there are other groups like this also, so certified massage therapists, estheticians, but your good or your product you're selling is essentially yourself. You're selling your clinical services, which creates this interesting aspect to this field where often when people are paid on an hourly rate, tends to be blue collar workers, who a lot of whom still need to punch time cards, and it's not necessarily considered management type white collar positions. That is not true for a service industry like being a physician or mental health clinician. You're at this white collar level of education and training, but the reality is you are working like an hourly employee. You earn your revenue by doing a service each hour, and that is how you get paid. And that is something different about this industry that people need to think about when you're thinking about traditional businesses. So that being said, to quantify your revenue, like you mentioned, let's put your revenue, every penny you earn through providing your services, that's going to be 100% of your right. That's 100% of the revenue. What we want to talk about are the models in, okay, where does that 100% go in terms of running your business, and what is the healthy way to do that? The first topic, that clinician pay piece, a lot of providers have some experience with that, because if you go sign up to work for one of the big groups that have spun up where they'll pay you hourly for seeing a provider, or there are a lot of practices, group practices, where you can go in and your pay is, we're going to give you 60% of the money you bring into the company. So on a very basic level, that first number, what goes to clinician pay and benefits, a lot of people know that in this field, it tends to be somewhere between 60 to 70% of the revenue that you're generating by providing your service. Let me pause there on that piece. Any questions?
Yeah, I mean, the first thing that comes to mind when I hear 60 to 70, and I'm the one that's providing all of the services that are providing the revenue, but obviously there are other costs that need to be paid, like the administrative staff, because they're not generating revenue inherently from the work that they do. I guess, how do you, if you're the practice owner, how do you communicate effectively to the clinicians that percentage that they're getting paid for the actual services that they provide is fair? Like, how do you keep them feeling like that's okay for them, that 60 to 70% is appropriate? Or, what's to stop somebody from going to straight to thinking like, hey, maybe I'd do better in a private practice, or, any thoughts there?
Yeah, and this is probably the biggest psychological piece. If you're going to have a group practice, or if you're going to sign up to work for an entity, and hey, I'm doing all this work and they're keeping 35% of the money. Is that fair? Feelings of fairness, and how each person understands that information are big factors on whether or not they're going to accept that rate, or if they accept it, if they're going to feel that they're being fairly compensated for their work. And I would say, Parker, that in general, financial literacy is not high, just in very general terms. Excuse me.
Okay.
But then, especially in this field where you don't get business training and understand other costs. For example, a lot of companies will hire you as a 1099 employee and say, hey, we're going to actually give you 65% of the revenue you generate. However, when you're being paid as a 1099 employee, your employer
No
doesn't
benefits.
have to pay that 8% of the Social Security and Medicare taxes. So
But
they
you
may,
do.
so you have to cover that if you're a 1099 employee. So that 65% all of a sudden has dropped to 57%. But employers will not share that with you necessarily. They'll tend to emphasize, hey, set your own hours, you're a contractor. That new laptop you bought, you can deduct that as a business expense. They won't tend to talk about that self-employment tax. And when people go from being a W-2 to a 1099 and they see, hang on, what's this extra tax bill? That can be very frustrating for a lot of people. So, understand. So I throw out that 60 to 70% number because for clinicians of any level here in California, for a lot of groups, that is just what the 1099 pay rate tends to be around. So a lot of people are familiar with that. A lot of other businesses, if you're selling a product, you tend to mark that up 100% so that the company is getting 100% revenue off that product. That's not the case for a service industry. So knowing, well, and then let's just hit the other pieces that you mentioned.
Mm-hmm.
The second category is this operational cost category, which goes to anyone who has a job or a task that's needed for running the group or the practice that isn't generating revenue. So that includes administrative employees, that includes cost of rent, that includes your internet provider, that includes your computer equipment. The nice thing about this field is there does tend to be lower overhead than other fields. But for example, if you're with a big group and they need to have a big billing team because they take insurance, you would want the company, you should be aware that there are a lot of people that maybe have to go on behind the scenes. And so that's
Right.
why they're only offering you 60% instead of 70% if it's a cash-based practice that doesn't need a big insurance billing team.
So in a lot of ways, the things that are happening in the background that like they can be afforded because that 30% is being taken are things that in a sense you would already be paying for if you were a solo practice. So like marketing, for example. If you have to pay for marketing and you're in a solo practice, well, if you're at a group practice, there's maybe a marketer who's working there, which like that cut of your pay is kind of helping pay them. So it sounds like it's almost like that 30 percent is helping cover the operational costs for the business. Does that make sense?
Yeah,
Or am I
and
making sense? Did I get that right?
you did, and the advantage of being in a solo practice is that operational cost percentage is going to be drastically lower. But the reason for that is because you're going to be spending a lot of your time doing the
Right.
operations personally. So even though the dollar value is lower, this is where almost certainly if you're spending 5 hours a week to do operational tasks, that is costing you lost income where you could be doing clinical work. And that's what people have to think about when they're looking at those categories.
Gotcha. Okay,
The
now let's. Oh, I'm sorry. Go ahead.
No, go ahead. Go ahead.
I was gonna say, like, let's, it's kind of like zoom out, because I'm not sure we covered this explicitly, but like, if let's say it's, it's 100% of a pie, and there's clinician pay, operational costs, and business savings. How are you breaking up that pie?
Gotcha. And this is subjective. So, but I will say the percentages that we use and that I have always used are 70% for employee pay and benefits, 20% for operational costs, and then 10% for business savings and for profit. And that 10% then of profit or savings can go into whatever's needed. It could go into hiring more staff. It could go into getting more office space. If you're a solo practitioner, that can be money that's left into the business. You want to always run at a profit, but it could go into a new 40, a new retirement plan that could go towards something else. When there's leftover money at the end of the year and you hit that sort of, hey, I got my 10% in my business savings, it's wide open to decide then what to do with that money.
Mm. So is that usually where, like, I don't know, like bonuses would come from?
I mean, the bonus piece, I I like to tie to that initial employee cost, that 70%. And
Gotcha.
in reality, and this is an intricacy of this service related industry. So we have our predicted revenue from a clinician, but we like to put models in place where people can beat those expectations. And then what we do is when people beat those expectations, which we try to make very reasonable, that then they can get whatever they go over that, a big chunk of that goes to just the employee bonus. So that's a way that we put in a bonus. There are other practices though that can be set up to where, if that business savings rate was actually 14% one year, hey, that 4% is going to be distributed out as additional bonuses to yourself or to your staff.
Okay, so for a group practice owner, how how do you approach determining how much you should be paying your admin staff? I mean, the clinicians, we've talked about, 65% that they can, 60 to 70%, of the services rendered, they keep that, and then the other chunk goes towards paying like the admin staff. How do you determine how much like admin staff should be getting paid? How much should you be getting paid? I mean, maybe you're a clinician, maybe you're not a clinician. How much should you be getting paid? How much should, leadership be getting paid? As if they're not actually generating revenue from their jobs inherently, or maybe they are. There's is everybody in leadership a provider, or is nobody, or is one person? A lot of ways to mix and match it. What do you think?
Yeah, and also, if you're a solo practice, you don't have to worry about anyone else's feelings or
Right.
issues with how you decide to pay yourself or how much you pay yourself. It sort of depends on how well you do with earnings. It is still important to see that percent of money going to running your business and then seeing that you have excess each year. With respect to the other piece, just to break down the topic on employee pay a little bit more, do do employees value benefits or salaries for, where they're at, and how do that 70% is to cover salary and benefits. Often for 1099 employers, all you get is a paycheck and maybe an option to purchase health insurance. So there is this benefit model where, in a robust group that gives really nice benefits with PTO, vacation, retirement matching, educational expense, travel, that benefit chunk can be a lot. And our old model that worked successfully for us was actually 50% of the revenue generated went to direct salary, 20% to benefits, and that's how we made that 70% up. And then within those benefits, we had a lot of things that were very desirable to the people in our group. So, starting with 4 weeks of PTO, with it increasing pretty quickly, 10 paid holidays, thousands of dollars of educational expenses. We even had, for clinicians who showed initiative, you could replace clinical work like with an hour developing a new group, which is great. A lot of people who have done a lot of training and education are passionate bunch, and especially about certain items. So we want to have people lean into their passions, but your company just lost revenue. So in order to do that, you need to kind of build that into your model that, okay, that money to pay for that time that would have come out of a salary is still got to come out of that 70%. So this is the balance you need to strike. And the other piece within it is, what are the work responsibilities for your clinic? So, at a very basic level, someone may come in and say, well, place X offered me $300,000, place Y offered me $250,000. Hey, and you're offering me $200,000. That, I'm not taking that job. But they've missed reading the details where, hey, that job that pays $300,000, there's no time off and you have to see 12 patients a day. The job that pays $200,000, you get 6 weeks off, you have all these benefits, and we're only requiring you to see 6 patients a day. And actually, we have this cool bonus system. So if for some reason, you want to burn yourself out quickly, and you just do decide to see 12 patients a day, you'll actually make more than that $300K with the bonus system. But it is very hard sometimes to explain those benefits and help people see exactly what they're signing up for. When for anyone looking at a job, it's not, hey, tell me about their retirement matching. It's like, no, hey, what's that job pay?
Right.
That's the first thing that's human nature. So
it's the first thing. You go to Indeed, it's the first number you see, looking through all it's good to look through all the benefits too, but yeah, it's the first thing you see. It's a different color even, it's bold. It's right there. So makes sense.
Yeah. And we can delve, I think when we do our budget podcast or do that training video, I have a breakdown of most common benefits so people can see, hey, if someone's earning $150,000 a year, here's how much each of these good benefits cost. And we will go over that. But that 70% is, the employee pay and benefits. There's a lot of ways to split that up. Now, to your question, then we've got the operational cost category of 20%. When you've got the nice thing is, and especially if you use Ripsy, if you've got an efficient system for doing scheduling and maybe you don't need as many admin people, or if you've got a slick billing system that's intuitive and easy to use and that saves a lot of revenue, our goal is to get that operational cost number down as low as we can. Because if we if our operational costs are only 15%, that's a lot of extra revenue that can go towards employee pay, that can go towards savings, that can go into rainy day funds. And having that efficiency around those operational costs is a real boost of sort of bonus money that you can do lots of good stuff with without it affecting that 10% savings you want to accumulate each year.
Okay. So we talked a lot about group practices, and we did talk about solo practice as well. But if I was a solo practice and I was looking at paying myself versus operational costs versus business savings, just to put it kind of explicitly, like how should I be thinking about those three categories?
Yeah, and so most people in the solo practice, they kind of look at how much did I earn this month? Okay, I'm going to cut myself. I know my monthly expenses are 2 grand. I made 15 grand. So I'm cutting myself
Sounds
a
like
check
a
for
great time. Great
yeah.
month.
I'm cutting myself a check for 1,300. So a lot of people on a basic level just see what they've earned, and that's how much they pay themselves. Which on some level is okay. You've covered your expenses, you take home the rest. The problem with that is it doesn't really prep you for understanding the ebbs and flows of your business. It doesn't give you a consistent paycheck for your personal budgeting, and it doesn't help protect you, in knowing like, hey, I want to get a disability policy. How much should that disability policy pay each month? So really, as a solo practitioner, the first step is knowing your personal budget and how much you need to earn. And then from that piece, using it to say, okay, I want to earn $100,000 a year from my business. That will cover my expenses. Let me see if I can actually earn $110,000, so that I can have a rainy day fund personally, and then calculate how many patients that is, how many hours a week do I need to work. I need to work more in September, October, and November because summer is slow for me because I work with kids. So I know August is going to be tough. And you just don't see that level of, I highly recommend getting yourself a fixed paycheck that you've thought out and planned. The other benefit of doing that, Parker, is, man, I can't pay myself and I'm actually thousands of dollars short to pay myself. It alerts you to these red flag situations that something needs to be fixed in your business model or your practice. And if you don't do that, you're setting yourself up for problems.
Yeah, I think this relates to something that we talked about pretty early on in the podcast, which was just like how and then this also fits into the budget piece, which we'll talk about in our next episode. Well, not necessarily next episode, because the next episode is a guest episode, but the episode after that, which was determining, how much do you need to be able to afford the life that you want to have. And making sure that number is balanced with what you can reasonably do. That being said, if somebody is they're just starting out and the income is inconsistent, how should they be thinking about do these percentages still play the same way when the income is maybe lower to start because you don't have a full practice, or how does that work?
Yeah, great question. And I think, depending on the business model, and if you're running a group, you'll have metrics on knowing how long it takes a new provider to start hitting their target clinical load. In very general terms, for coming into an established group practice, even if there's unlimited patients to schedule, it's still going to be 2 or 3 months to get someone's schedule full. If you're in private practice, and don't take insurance, you are looking at more of a 6 to 12 month period until your practice is full. That if you're kind of doing basic word of mouth advertising or not spending a ton of money on the advertising piece, it's rare for a private cash practice to get full in less than 6 months. Certainly that's not always the case. So what are you going to do during that time to make ends meet? And that's why a lot of people will maybe take a part-time job elsewhere. A lot of people will sign up for one of those big groups where they know they can put some patients in, and maybe they're only getting paid $60 a session from that big group versus the 150 they'd get from their own patient. But it's still $60 versus nothing, can help you get to that basic make ends meet until your practice is at the point where you're covering your expenses.
Okay. I had another question, but it's eluding me. But this makes sense. I guess the question was, and I think we've talked about this before in the past, how based on that scenario that you just gave, my mind went straight to, what's stopping that person who's working for the group, but that also has their solo practice, from moving their patient at the group practice to their solo practice. It's maybe not necessarily relevant to this podcast, but it's just the thought that came to mind.
Yeah, and that is, you're right. I think we've talked about it, and the reality is even if the practice says, the patients belong to this group,
patients can go that you have no loyalty to your barber. Like there's a, or how's that? Yeah, no, we have talked about this. It's all coming back. Yeah. At the end of the day, if your barber opens their own barber shop, and you want to go to their barber shop versus, I don't know, Supercuts. There's nothing stopping a patient from doing that.
Right. And this does happen all the times, and it's sort of another, if we ever do a series on like really just for group owners, the reality is that a lot of people who start in groups are, fresh out of training or newly graduated, and maybe not, don't have enough experience to go out and do a private practice on your own. So you should actually predict in your business models that you will have a good chunk of employee turnover within 2 to 3 years for a lot of your employees. If you can and it's not salary that tends to keep people, but it's actually the benefits and workplace. Mm-hmm. So if you want to do better and keep people for decades, you need to have a reasonable salary, but it's actually, hey, are there nice people there? Do you get to present at a conference? Did you develop a group? Are you, giving leadership opportunities? Are people feel valued? That's where people will stay with you. I think on the West Coast or in high cost of living cities, and this just happened to a good friend of mine, they had brought on a clinician who stayed, I think 3 to 4 years, so better than the 2 years. But ultimately it got to a point where, again, you can always make almost double what you're making in a group practice if you successfully go to a private practice. And when you want to buy a house that is millions of dollars, if you're not living in a more cool place like Atlanta suburbs where you get your dollar goes much further than the Bay Area or LA, like you can't judge people for that, but there's no way you as a group owner can match what someone can earn in private practice, and that's just reality. So can you make up for it with these other benefits in workplace? You definitely can, but you also need to not take it personally or begrudge people, and it should be built into your model that people are going to leave. So you need to be thinking about always bringing new people in.
Well said. Yeah, I hadn't even considered that. That's great. Okay, then I know we're running close on time, so let's move to the mental health business moment of the week. I know you were debating what that would be before we started recording. Do you have it?
Yeah, what did I settle on? Well, and last week, so our nonprofit is getting ready to grow again. Mm-hmm. And I think it's this piece where, previously I've run many businesses, but I had made a commitment that I'm going to just be the operations person this time. And I'm going to yield the executive director role to another individual. And yeah, as the growth is beginning, I've had some, it's a good process to always be working on these skills, but I've recently had done a lot of processing about stepping back and actually not trying to intervene, whether it's just I feel something could be done differently or trying to prevent certain mistakes. Like there's only so much you can do, and you have to really understand your role and what you've agreed to. And so it was just a little, in thinking about the business moment and reflection of coming to terms with, this is the role I've agreed to behind the scenes. I need to let other leadership lead the company and be at peace with that. And I feel I've reached that peace, even though it took a while.
That's awesome to hear. I can relate to that sentiment of I guess staying within your boundaries of what you're supposed to be doing versus what's maybe somebody else's responsibility. I think certainly at RipsyTech, yeah, we're typically inclined to just like, if you can do it, go do it. But in a situation like that, it sounds like it sounds like you've hit the right spot. Making me think about the work I'm going to need to do for myself in that regard in the future, but we'll see.
True, and and I'll I can throw that CEO energy into RipsyTech, and and as the company grows and your title changes, Parker, you will have more of those reflection points to deal with, but.
I'm sure. Appreciate that. Okay, well, this has been great, Tom. Another episode on the books. So let's go ahead and wrap things up. Thank you for listening to this week's episode of the podcast, Sit and Stay Podcast, brought to you by RipsyTech. If you enjoyed the episode, go ahead, subscribe, like, follow, 5-star review, anything you can do to help out the show. We greatly appreciate it. If you want to contact us, reach out at sitandstay@ripsytech.com, and we will see you next time.
Awesome. Thanks, Parker.
All right. Bye, Tom.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at ripsytech.com.